Well, earlier this week, the World Health Organization put out some pretty startling numbers concerning measles across the globe, and we see some pretty high numbers as compared to previous years. So let's take a look at see what the World Health Organization had to say. They say measles outbreaks continue to spread rapidly around the world, according to the latest preliminary reports. In the first 6 months of 2019, reported measles cases are the highest they have been in any year since 2006, with outbreaks straining healthcare systems and leading to serious illness, disability, and deaths in many parts of the world. There have been almost 3 times as many cases reported to date in 2019 as there was during the same period last year. This follows successive yearly increases since 2016, indicating a concerning and continuing upsurge in the overall measles burden worldwide. And they mentioned some countries that we're going to look at in a little bit more detail in a moment that have had really massive outbreaks. Democratic Republic of the Congo, Madagascar, and Ukraine. And then there's other major outbreaks going on in other parts of the world, including the Philippines and Thailand and Nigeria, for example. They said these largest outbreaks are in countries with low measles vaccination coverage currently or in the past, which has left large numbers of people vulnerable to the disease. At the same time, protracted outbreaks are occurring even in countries with high national vaccination rates, like here in the US. This results from inequities on vaccine coverage, gaps and disparities between communities, geographic areas, and among age groups. And they talk about the United States, we'll get to that in a little bit. In the European region, this is a pretty astounding number. There have been close to 90,000 cases reported for the first 6 months of 2019, and that exceeds the whole of last year, all of 2018, which had about 84,000, and it's already the highest number in this current decade. And they do give some provisional numbers down here, and I want to just touch onto these pretty quickly. From January 1st to July 31st, 7 months, 182 countries reported 364,808 measles cases to the World Health Organization. For the same period last year, 2018, 129,239 measles cases were reported from 181 countries. Africa's seen about a 900% increase in measles cases. Europe, about 120% increase. Western Pacific, Southeast Asia, that area, about 230% increase. The only areas that really saw any kind of a decrease was the Western Hemisphere, the Americas, right, and Southeast Asia region, which would include, Bangladesh, India, and those countries. So, yeah, some pretty astounding numbers coming from the World Health Organization earlier this week. So let's look at some of this stuff in a little bit more detail. And we'll start with Ukraine. This is a country we cover very closely here on the website outbreaknewstoday.com. And their measles cases mellowed out a little bit over the summer while the kids were at school, but health officials there are now saying that it's starting to pick up again. And just in the past week, there was about 261 cases. So that's really quite small to some of these previous weeks when there was, a couple thousand cases a week. But it is a little uptick from what we saw over some of the summer months. And it says since the beginning of the year through August 9th, there was 57,000 measles cases, about 27,000 adults and 30,000 children, and 18 fatalities. Since the outbreak really started back in the summer of 2017, there's been 115,000 measles cases in Ukraine with 39 fatalities. So why so bad, right? Why is it so bad? Well, the Red Cross over in International Red Cross, it was in Ukraine, and this is from earlier this year. And it says, poor immunization coverage has contributed to the measles outbreak in Ukraine. In 2018, the measles vaccination rate for newborn babies was only 54%, which is amongst the lowest in the world. And it's well below the target of 95% recommended by the World Health Organization. And of course, we know this already, but it says a rate of 95% would protect even those members of the community who cannot be vaccinated for medical reasons, hence the herd immunity that we hear about so often. So yeah, just a big problem. Officials say that the low coverage rate and widespread transmission of the virus is due to many factors, and they include transport costs for those in rural areas, a high number of people with weakened immune systems, such as living with HIV and tuberculosis, and vaccine refusal. So, yeah, so that's a snapshot at Ukraine and why they're in the position they're in today. Elsewhere in Europe, of course, Ukraine's not by itself. This is from the European Center for Disease Prevention and Control, the ECDC, and this came out just recently, and this is for the first 6 months of the year. And they're reporting, I think it was about 13,000, over 13,000 cases in the past year. And that includes over 10,000 that were laboratory confirmed. And we see that France and Romania, Italy, these were all the countries that were hit the hardest with measles in the past year. And of course, some of these numbers are probably underestimates, artificially low, because it usually is that way, right? Measles continues to spread across Europe because vaccination coverage in many countries is suboptimal. Okay, so there's a lot of countries in Europe that are just, they have these gaps with their vaccinations, or they're not getting vaccinated at all. So, yeah, so that's a problem in Europe. We've been keeping tabs on that for some time also. Here in the U.S., through August 8th, there was 1,182 measles cases confirmed in 30 states. This, of course, is the largest measles outbreak in the United States in 27 years. So it's a big thing. We look at this number and we compare it to some of these other numbers, but this is really a big number for the U.S. And this is something, measles was declared eliminated in 2000. And here we are 19 years later, and we're seeing over almost nearly 1,200 measles cases. And the year's only about not even 2/3 of the way done. And they say that 124 of the people who got measles this year were hospitalized. 64 reported having complications, including pneumonia and encephalitis. And fortunately, nobody has died. More than 75% of the cases this year were linked to outbreaks in New York and New York City. And all the measles cases this year have been caused by measles wild type D8 or B3, so different measles strains of virus. Now, in Africa, the Democratic Republic of the Congo, as far as I know, has seen the most cases of any individual country this year. And the latest report from the World Health Organization put it at 137,154 cases. And get this, 2,581 fatalities. This is through late July. So yeah, big problem in DRC, and their problems are numerous. Um, in addition to the measles outbreak, of course, they're battling the Ebola outbreak in North Kivu and Ituro provinces. So those outbreaks are going on concurrently. Major problem, right? Um, Measles vaccination coverage remains low across the DRC. According to the multiple indicator cluster surveys, the estimated coverage for measles containing vaccine 1 was 57% in 2018. And the routine immunization program offers only a single dose of measles containing vaccine to children at the age of 9 months. So, yeah, they just have so many problems going on in DRC, and measles is one of them. And it says here, the outbreak is occurring in the context of a protracted humanitarian crisis characterized by high levels of malnutrition, multiple outbreaks of epidemic-prone diseases, including Ebola, mass displacement of populations in conflict-affected areas, and a weak health system. So, yeah, DRC is really struggling with a lot of things, including measles. Another African country that has reported over 100,000 cases this year is Madagascar. Though we aren't seeing many cases coming out of Madagascar in recent weeks and months, it was really ramped up during this winter and springtime. And from September of last year through May, according to this chart, they reported over 145,000 measles cases, including over 900 fatalities. So, yeah, but like I said, it looks like that the measles outbreak in Madagascar is getting under control. There's been a decreasing trend of incidents going on for weeks, if not months. So, but still, 145,000 cases in a matter of, half a year is pretty astounding. Now, like I said, one of the places that didn't really see an increase in cases, in fact, it was somewhat of a decrease, about 15%, was the region of the Americas, the Western Hemisphere, right? North, Central, and South America. And for the first 7 months and a week, there was about a little over 2,900 confirmed cases of measles and 1 fatality so far this year. The interesting thing here is the country with the most measles cases in the Americas in 2019 right now is the U.S. The United States has the most, followed pretty closely by Brazil. And this differs from, this differs from last year, when the top 2 countries for measles cases were actually Brazil and Venezuela. So that's what's going on in the America region. And let me go ahead and close it out with some stuff going on in Asia. And we do see some countries getting hit with a lot of measles cases this year. The Philippines is reported about 37,000 suspect cases, and I think there's been, 23,000 cases that have been confirmed to date, and there's been several dozen fatalities due to measles. Other countries that have been hit hard by measles has been Vietnam and China. So, yeah, so measles is a big problem this year. The World Health Organization really let us know in this very informative release earlier this week. So, yeah, these people need to get vaccinated, and this is definitely an issue. This is something that is very preventable, very, very preventable. This vaccine essentially gives you lifelong immunity. And it's really a shame that it's gotten to this point. Anyway, that's what I got to tell you about measles this week. And I hope you enjoyed what you saw. And I encourage you to comment and subscribe, and of course, share with your friends. And I'll see you next time.